So, good afternoon, everybody, and welcome to Lunch and Learn on Thursday, July 16th, 2020. My name is Holly Dinnany, and I am with Family Partners of Morris and Sussex County, and it is my pleasure to welcome you to our lunch today. This is a lunch and learn. We consider this that you're having lunch with experts, and today we're getting two for the price of one. We have Tina Hugh and Katie Calvacca with us from the Center for Prevention. And a few housekeeping items. I just want to remind everyone to please keep your mute on to minimize background noise. And also that if you have questions or comments throughout the presentation, we invite you to use the chat function. And if you're familiar with the chat function, you're able to select whether you send a message to someone privately or whether you share it with the group. So that is one avenue for conversation that we have throughout the presentation. And I know Tina and Katie will be open to entertaining questions. And I'm sure we'll have time at the end as well. So Tina is the Director of Prevention Services at the Center for Prevention, and Katie is a certified peer recovery specialist. So they're here to talk to us today about Sussex County and substance abuse trends, substance recovery resources. And I mentioned to Katie and Tina at the beginning, I'm happy we're talking about this today because earlier this month we were talking about the many good things happening in Morris County, because it's exciting to see that there are so many resources, and we're learning and growing in our ability to support the folks in our community who need it, which benefits us all. So with no further ado, I am going to invite you to, by the way, if you're nibbling on your lunch, that's okay with us. We'd love to see your smiling face, but if you're nibbling on your sandwich, feel free to keep your camera off. And with no further ado, I'm going to turn it over to Tina and Katie.
Thank you so much, Holly, and thank you to Family Partners for hosting this series of Lunch and Learns. We really appreciate being invited to participate. You know, during this time of social distancing and all the economic struggles and uncertainty, stress can be too much for some people to handle, especially our more vulnerable populations in our county, including our youth, our young adults, those in recovery, and those that are seeking recovery from substance use disorder. So again, we do appreciate you inviting us to present this afternoon to raise awareness of drug trends that we're seeing here in Sussex County among our youth and our young adults. And Katie's also going to be sharing with you some really valuable resources that are available through our recovery supports and of course our treatment options as well. So I'd like just to take a minute to talk a little bit about the work that our agency does. Center for Prevention and Counseling, many people know it as CFPC. We're located in Newton. We're a nonprofit agency that has been serving the Sussex County community for over 45 years. We're dedicated to community wellness and recovery from substance use disorder. The CFPC prevention team, the treatment team, and the recovery team all work in concert with each other to bring together an educated and evidence-based community approach to healthy living that's free from substances. Our prevention team has certified prevention specialists that offer evidence-based programs to different sectors of the community. We also have two prevention coalitions. One is in Newton that serves all of Sussex County, and one is in Vernon. We offer clinical services. We have credentialed counselors and clinicians who provide a variety of outpatient services for both adolescents and adults. Our team members are trained in a variety of interventions. We also offer medication-assisted treatment, and this is to sustain recovery for those who have experienced setbacks or are struggling with substance use disorder. Our recovery support service staff assist people with substance use disorder before, during, or after treatment, really throughout the entire process. And you'll be learning more about those services.
No, yo no sé qué les pasó hoy. Qué cosa tan horrible verlos tratando así. Por favor.
Katie, maybe we can mute all of our participants.
Got it.
Okay. Maybe with the exception of Holly and you. Okay, great. So we have a short time together this afternoon. So we're going to be talking about our most prevalent drug trends, including underage drinking, alcohol use disorder, marijuana use, vaping, non-prescribed prescription drug use, and opioid use. And while it's important to understand trends, it's also important to understand prevention measures that can be taken. So we have prevention sprinkled throughout this afternoon's presentation. We will be scraping the surface with signs of use. Therefore, we do have a resource that family partners will be sending out to all who are participating today, which includes our signs and symptoms and other resources if you are looking for more information or to seek help. I think it's important to understand, are all kids using drugs? Absolutely not. In fact, the majority of youth are not using drugs. A lot or substances, including alcohol. When we go through this afternoon's information, a lot of the data that I'm going to be sharing with you comes from a survey that we do every 2 years in our school districts. 3,500 kids participated in our latest survey, and this was done in December of 2019, so 6 months ago, grades 6 through 12. So I think that information is important to understand, and the data is certainly relevant. But before we move on, you know, there's a question that parents and caregivers typically ask when we're talking about substance use and adolescence. And the question is, why do kids use? And I think it's important to understand that there isn't one specific reason why youth choose to use substances. There's a variety of reasons, whether it's other people, perhaps parents or siblings or friends are using alcohol or vaping or using marijuana. If a young person sees it often, it becomes their norm. It becomes part of their teen years, which puts them at greater risk for developing addiction or substance use disorder. There's also popular media, whether it's music or streaming movies or different series that are available now on online platforms. A lot of these media outlets glamorize drug use. Also to escape, you know, we have youth that perhaps are suffering from depression, anxiety, and undiagnosed mental illness, so they're using substances to escape from those effects. Boredom, but also misinformation. Perhaps young people don't understand that marijuana is addictive, or perhaps the puff bar, they think the puff bar doesn't have any nicotine. Some teens are naive to the risks of using alcohol and other drugs. It's always important to know who we are talking to in our audience. So I'm gonna ask you to participate in a poll. Let's see, I'm gonna launch this poll. So if you can just quickly check off which sector you represent, it will give us an idea of who we're talking to. We'd appreciate that.
The wonders of technology. Okay. Isn't that cool?
Okay. All right. So we have some family members, mental health provider, community member, other prevention folks. Great. Great. Okay. So we're going to move on to talk about our first substance, and that's alcohol. And while we have seen significant decreases in underage drinking for the last 10 years or so, we still have work to do. With our PRIDE data, we were able to recognize that among our 8th and 11th and 12th grade populations, we saw an increase in underage drinking. So in 8th grade, we saw a 34% increase in use from 2017 to 2019. Now, what that means is 7% of those kids reported that they had used alcohol in the last 30 days. Our 11th graders, we saw a 9% increase within that same time period. So nearly 28% of our 11th graders reported using alcohol within the last 30 days. Within our 12th grade population, we saw a 3% increase, which doesn't seem alarming. However, that data shows us that nearly 35% of all 12th graders had used alcohol in the past 30 days. So we are actually 15% higher in our underage drinking among our 12th graders than the national average. So that is an area to focus on and an area of prevention. So why is this concerning for us? Well, we understand through science and research that almost 70% of adolescents who start using alcohol before the age of 15 will also try other drugs, other illicit drugs. We also know, which this is so important, is that the adolescent brain, it's in an amazing phase of rapid development, learning and growing all the time. This is why it's easier for young people to learn an instrument or speak a new language than it is for adults. But it also makes the adolescent brain more vulnerable to injury. And this is including injury from using alcohol and other drugs. Our brain continues to develop into our mid-20s, and the region of the brain that controls emotions and impulses and help us make decisions are among the last to develop. This is why adolescents are more likely to take risks and make impulsive decisions. So protecting the brain during this period of development is crucial to a person's overall health and reduces the risk of developing an addiction and a substance use disorder. We also know that nearly 90% of adults with a substance use disorder started using alcohol or drugs before the age of 18. Research tells us the earlier someone starts using substances, the greater their chances of developing a substance use disorder. So prevention efforts focus on delaying the age of first use or pushing it back as long as possible, whether that's alcohol, tobacco, or marijuana. Those are the three most common used substances among our teens. I would really be doing a disservice if I didn't mention that while we are talking about underage drinking, we do also need to start having more conversations about alcohol use disorder among adults. Most of our referrals for our ORP program, which is our opioid overdose recovery program, which Katie will talk to you more about. Most of our referrals for that program are not for opioids, it's for alcohol use. In 2018, Sussex County ranked second in New Jersey for alcohol-related emergency department utilizations for the 18 to 30 population. So we need to think about that for a minute. These are young adults. Whoops, sorry, I didn't mean to go ahead. These are young adults in their childbearing years or their young parents. So again, that's why we are concerned. I have a poll that I'd like to share before I move on to the next slide. Let me see. Here we go. Okay, this has to do with marijuana because that's the next topic we're going to move on to. Do you believe today's marijuana is similar to marijuana from the 70s and 80s?
Do you have the poll up? I can't see it this time. Maybe it's because I'm a host. I'm just checking in.
It's because you're a host. It's up.
Okay, that's fine. Gloria. I can see the other one though. That's interesting. Sorry, folks. Wanted to make sure everybody had a chance to vote.
Okay, I'm going to end the vote. I'm going to end the polling. So, okay, there we go. So interesting. Several of us weren't sure about marijuana, so we're going to talk about this, and I invite questions. I was in upstate New York last week for the week, and I saw a billboard in Saratoga County that said, "This isn't your grandma's pot." And that is so true. It was in Saratoga, New York, and they have a fabulous prevention coalition. And there's a misconception that it's just weed and that it's not a big deal. But we need to understand that today's marijuana is a completely different drug than it was in the 60s, 70s, 80s, even the 90s. In earlier years, THC, which is the active ingredient that gets an individual high, was 3 to 5%. It truly was a weed. You couldn't really become addicted to that. Now it's genetically modified to have higher THC concentration. Right now, marijuana can be between 13 and 18% THC, and that's your vegetative marijuana. So that's the marijuana that's been around for a long time, okay? But we have all kinds of other marijuana products that are available, your waxes, your oils, and your edibles. And these range anywhere between 70 and 95% THC. So it's a completely different drug that has different results. Today, we have the youngest youth using the most potent marijuana that has ever been made available, which is important to understand. Also, among some populations, there's some confusion about whether or not New Jersey has legalized recreational use of marijuana. We have not done so yet. It will be up for vote, and it'll be up for the new residents of New Jersey to vote on November 3rd. It will be on the ballot. So for prevention, we have a few months to really get the word out about marijuana and the impacts of legalizing marijuana within a community. So getting back to our Pride survey results, again, these were from December of 2019. In 11th grade, we saw a 22% increase in use. So nearly 15% of our 11th grade population reported they had used marijuana in the last 30 days. 12th grade, we saw a 24% increase in use, which means 21% reported they had used marijuana in the last 30 days. This was not surprising to us, as we knew the landscape of marijuana has been changing in New Jersey. And when availability increases and perception of harm decreases, use of any product typically rises, typically increases. So there are many different prevention efforts, both on a federal, state, and local level, aimed at reducing youth use and providing more awareness regarding marijuana use and the effects on adolescents. So signs and symptoms, I'm not going to go through signs and symptoms of every drug we talk about, but I think it's important for marijuana because you have this in a handout that family partners will be sending to everybody. But for marijuana, glassy red eyes, dilated large pupils, lack of coordination, increase in, sweet craving foods, increase in eating. Long-term use could be weight gain. Also, you'll hear me talk about it a little bit more with the different types of marijuana. The THC ratio is different. So those higher level THC products could produce paranoia and psychosis among some individuals. So that is also a sign of marijuana use. Those things alone, plus whatever, changes in friends, changes in behavior, changes in appearance, you would keep all of those things in mind. But again, something to be mindful of. So why is prevention important, and why are we so concerned about youth use? Well, the Surgeon General released an advisory last August regarding how marijuana use negatively impacts the formation of brain circuits important for decision-making, important for our mood, and important for our response to stress. And this is among teenagers. Additionally, the Surgeon General stated the risk of physical dependence, addiction, and other negative consequences increase with exposure to high concentrations of THC and the younger the age of initiation. higher doses of THC are more likely to produce anxiety, agitation, paranoia, and psychosis. As I said earlier, we have the youngest kids right now using the most potent marijuana that has ever been made available. So again, this is our concern. So while we are certainly concerned about our young population using marijuana, we also need to be concerned about our young adults. In 2018, Sussex County ranked #1 in New Jersey for marijuana-related emergency department utilization for the 18 to 30 population. We ranked first. So again, these are young adults in their childbearing years and or parents of young children. So I think it's important to understand there's various marijuana products. So there are edibles, and these are not, recreational use of marijuana is not legal in New Jersey, but we do have edibles here in Jersey that are here illegally. And they're produced in mom and dad's kitchens or, purchased online and sent through the mail. It's very easy to Google or YouTube recipes. They're homemade products. High levels of THC, anywhere between 60 and 80% THC, these products could be. What's most important to understand with edibles is that edible marijuana takes time to absorb in the body and to produce the effects. So it could take 1 to 2 hours. So individuals don't necessarily understand that. So they might not feel that desired effect. So they're going to consume more of that edible, which leads to an increase in going to the ER, which leads to an increase of unintentional overdose. We're also seeing an increase in accidental ingestion by children regarding these products, because a lot of them look like candies that you would give a young person. The Jolly Ranchers, the gummies, the hard candies, there's lollipops, there's brownies, there's all kinds of products. So this is all about wax and oil. And for those of you that aren't familiar with, marijuana all that much, wax and oil is a very concentrated form of THC, anywhere between 60 and 95% THC. It's the product that is most often used in dab pens. A dab pen is actually used for marijuana. But these oils can also go into a lot of the vape devices that are used. It's, again, a high concentrated form of THC. One of the biggest issues with the vape devices and the dab pens is that when somebody is using marijuana, there's not really that odor that you would smell as if somebody was using other forms of marijuana. So it might be a fruit smell, depending what else was in that vape, but it might not be any smell at all. So it's really difficult to detect if somebody is using wax or THC oil in their vape device or the dab pen. But slang for using these products is, I hear a lot: honey, dabbing, wax, oil. Again, the risks of physical dependence, addiction, and other negative consequences increase with exposure to high concentrations of THC, and the younger the age of initiation. And these oils and waxes are really appealing to our young population right now. Okay. So I'm going to move on to talk a little bit about vapes. And while we are all familiar with Apple and their generations of iPhones and iPads and tablets, e-cigarettes also have generations of products. And right now, we are experiencing the 4th generation, and these are called pod mods. And these are most popular among our youth. So you can see we have some Juul products up there. The Surin Air is the one that looks like a teardrop. All of these devices contain nicotine, anywhere between 3 to 5% nicotine. You can purchase the pods separately. And you have that option of 3 to 5. In fact, I see 5 more than I see 3. Young people are not aware of the amount of nicotine that are in these pods, and they are becoming addicted to nicotine. We're at a time right now where smoking, traditional smoking combustible cigarettes was at an all-time low. And there was years of prevention work that went into getting smoking at an all-time low among our young people. But now with these trends, it's reversing all of that prevention work, because what's happening is that the young people are using these products, becoming addicted to the vape and the nicotine in the vape, and then becoming dual users and moving to either combustible cigarettes, or believe it or not, cigarillos or cigars are starting to become more popular. The e-cigarettes are #1 in popularity, but the second one in popularity are cigars among youth. Locally in Sussex County, 21% of our 11th graders and 28% of our 12th graders reported that they had used a vape in the past 30 days. Now, we don't have anything to measure that against. That's baseline data, because in 2017, the survey tool that we used did not specifically talk about e-cigarettes. So this for us is baseline data, but it does fall in line with what we're seeing nationally. And again, this information wasn't, it wasn't surprising to us, because we knew youth use was increasing, and there has been a lot of work done through federally, state, and through local prevention efforts to address this. The most popular e-cigarette right now is now the Puff Bar. It has now kind of become mainstream, and while Juul is still somewhat popular, it's not nearly as popular as Puff Bars. Puff Bars are disposable e-cigarettes. So you use them once, they come pre-charged. You get about 300 puffs out of one Puff Bar, but once it's done, you just toss it in the garbage can. Then they come in a variety of flavors, more flavors than what Juul had put out when Juul was able to produce flavored pods. And again, these are high, nicotine content is high, 5%. Now, the good news is New Jersey is really ahead of the game in terms of prevention and policy. In January of 2020, New Jersey was the first state in the nation to impose a permanent ban on flavored vape products, and that includes disposable products. So this prohibits the sale and distribution of flavored vape products, including menthol, and that took effect April 20th, 2020. New Jersey also prohibited coupons from being used on any type of tobacco product. So that's combustible cigarettes as well as cigars to vape products. Now, with that being said, April 20th was a few months ago, but these products are still widely available in our stores. So whether the health department, and I don't mean our Sussex County Health Department, I mean our state health department, the education still needs to get out to our merchants and our stores, retailers about this, because unfortunately they still are readily available in our markets, although as April 20th, they were prohibited. So we will start to see decrease in the availability of those products. Okay, I'm just checking my time here. So the next drug we're going to talk about is cocaine or crack, and I'm just spending a second on this slide because while we are not seeing this among our youth, it's important to note that it is something that we're seeing more often in Sussex County. And when we talk about substance use disorders and opioid use disorders, it's not typically one drug. We experience polydrug use, and there's a slide in just a little while that we'll talk about that. But this is a stimulant, and the high does not last as long, so people typically go on binges. And again, this acts as a stimulant. Nothing that we're seeing pop up on our radar in schools hasn't popped up on our Pride survey, but again, it's something that we are hearing about among our adults more often now than we had in the past. Okay. Over the last several years, policies and practices have been put in place in New Jersey to reduce the risk of addiction due to prescription drug use. The CDC guidelines for prescribing narcotics were put into place. Prescription drug monitoring program was put into place in New Jersey, which prevents people from doctor shopping to obtain more pain medication. The Project Medicine drop boxes were installed, which allows individuals a place to dispose of their unwanted, unneeded, expired prescription drug medications in a safe place. However, non-medical use of prescription drugs still continue to be a concern. And while we're most concerned about prescription pain medication, there are other substances that we're concerned about, other prescription drugs that we're still concerned about. So while all prescription drugs have a place and play a crucial role in the quality of life, they can also be misused. A few are noted on this slide. Most people with substance use disorder are polydrug users, so they're using more than one substance. Those that have passed away from drug overdose, the majority had more than one substance here in Sussex County. These include benzodiazepines used to treat anxiety or panic disorder. These can be abused and are often used with other drugs. We also have gabapentin, and gabapentin is a medication used to treat seizure disorder, but it's also used to treat nerve pain. And those with an opioid use disorder may seek out gabapentin in an effort to perhaps strengthen the effects of opioids. And use and misuse of this specific drug is rising faster, in particular among those with opioid use disorder. I also want to take a second to talk about amphetamines. And amphetamines are also known as smart drugs, and these are not associated with gabapentin or benzodiazepines. These are popular among our college age students and our 11th, 12th grade high school students. These are popular among people who need to cram for an exam or pull all-nighters to work on a project. For our young people, it might be people who are working more than one job, maybe 2 or 3 jobs, and they need that energy and the ability to be able to stay awake. Sharing these medications or selling these medications in an effort to increase productivity is not uncommon. And abuse can lead to high blood pressure, increased pulse rates, insomnia, loss of appetite, and also physical exhaustion. So these are drugs that we're definitely always educating about and being mindful about among our community members. This is just, I'm just going to take a second to talk about this slide. This is just a slide that shows the growing concern of polydrug use. You can see that the majority, this is not a Sussex County slide, this is a United States slide, but the majority of opioid deaths co-occurred with benzodiazepines, cocaine, or methamphetamine. Okay, I had mentioned earlier our prescription drug boxes. We have 10 of them in Sussex County, and we always say secure, monitor, dispose. 365 days a year, 24/7, these drop boxes are available. And again, this is an effort to just dispose of those prescription drugs in a safe place. We also have 2 national take-back days, one in the fall and one in the spring, which allows us to really do targeted prevention during those time periods about safely disposing of prescription drugs. So I had mentioned that the big concern, while there's concern about other prescription drugs, there was a big concern about our prescribed pain medication. And that is because the progression of use is usually easy to predict once somebody is addicted to those pain medications. Once an individual becomes addicted to pain medication, the path can lead to heroin use. It's important to understand that heroin binds to the same receptors as opioid pain medication. So it's the same, it produces the same results. Heroin is cheaper and it's easier to access. In February, a public health alert was issued in Sussex County due to a rash of overdose deaths, 11 overdose deaths in 1 month. Our agency enhanced our services, offered additional Narcan trainings, Narcan kits, and provided education and awareness during this time. And Katie is going to talk about all the excellent work that is being done to address this situation, because it didn't go away. We've had 22 drug overdoses between January and the end of May. It didn't go away because COVID came. It's still happening. It's just not gaining the attention that it was before, because COVID is now kind of taken over, the news and media. Okay. So illicitly manufactured fentanyl is the main driver in the overdoses that we are seeing, and the heroin overdoses that we're seeing. So fentanyl is much more potent than morphine, and only a very small amount can lead to a person overdosing. Fentanyl is cheap, it's beneficial for dealers to include in heroin, and the results can be deadly. So that is what's contributing to the rash of overdoses that we've been experiencing for the last several years. I was listening to the news this morning, and I had heard, I'm not going to say, I don't have numbers in front of me because I didn't pull up the report, but the CDC, I believe, yesterday released a report that 2019 was unfortunately surpassed prior years in drug overdose deaths. So again, in 2018, we saw somewhat of a reduction in drug overdose deaths, but 2019 trend reversed the work that had been done. So much more work needs to be done to address this situation. Okay, I talked about some of the state legislation that was put into place to protect against addiction and to opioids. But as a result of the opioid epidemic, several New Jersey laws and policies have been put in place to affect change at the school level. So this raises awareness, prevents the onset of use, and prevents overdose from occurring. So each high school is mandated to have a Narcan kit on site and a trained person on site. And parents and students now need to sign off on a fact sheet that they are aware of the effects of opioid use if they're prescribed from their doctor. They're aware of the addictive nature of it. And they also have to watch a video that is for athletes, because we know that student athletes are at higher risk for addiction. We also have the Overdose Prevention Act, and this protects people who have experienced or witnessed a drug overdose. They will not be prosecuted. So the reason for this is to save a life. This person should not be afraid to call 911 to seek help in the event of a medical emergency due to substance use. And then there's also expanded access to naloxone, and Katie will talk about what that means. So in schools, there's a really easy process for schools to follow. I don't want to say easy. There's nothing easy about substance use disorder, but there's a policy in place. There's a procedure. So if somebody is suspected to be under the influence of alcohol or other drugs, they are referred to the SAC. They get a substance use evaluation. A healthcare provider gets involved, and that person receives, hopefully, early intervention or treatment if needed. But what if you are a parent at home? What if you suspect that your child or loved one is experimenting or using substances? The question is, what does the person do? It's important to have a direct and calm conversation about it with that young person in your life, whether it's your child, if you're a caregiver, whoever that teenager is. It's important to ask open-ended questions and show support to that young person. It's so important to show support to that young person so that they understand there is a caring individual that will help them work through whatever it is that's leading them to use substances, and so that they know that they're not alone in whatever needs to happen in the future to help them become healthy. It's also important to contact a healthcare provider for a checkup to ensure the health of the individual, as well as a treatment agency that can provide early intervention and treatment if necessary. And you know, here in Sussex County, we do offer that here. We offer adolescent treatment, and Katie will talk a little bit about our treatment services. So these are some additional resources. Partnership for Drug-Free Kids is an excellent website. And if, you know, people weren't sure how to start the conversation with their child, they actually have conversation starters and role playing on this website. So it can help you or help parents, help loved ones understand how to start those conversations. Parent advice is specifically about underage drinking, and Partnership for Drug-Free New Jersey, again, is also another excellent resource for substance use disorder prevention, treatment, and recovery resources. So I am going to turn this over to Katie. Again, you know, we just scraped the surface of prevention. You know, if you ever have the opportunity to attend one of our longer drug trend updates or Hidden in Plain Sights, which are both of those are 90 minutes, you know, feel free to always join us. And we get into a little bit more detail about all that I had spoke about. And again, with what Katie will talk about. So Katie, I'm gonna turn it over to you to move us forward with resources for recovery.
Thank you, Tina. My name is Katie Calvacca. I'm the Recovery Support Coordinator at the Center for Prevention and Counseling. I am also a person in long-term recovery, which for me means that I haven't had a drink or used a drug since 2008. And I share that with you because we don't often hear enough about recovery. Tina went over all of the trends in substance use, and most people understand what the negative consequences of addiction are. We can open the newspaper, we can turn on the computer and learn about overdose deaths. We can see who's gotten arrested, but we don't see when people celebrate recovery. So I just wanted to share this picture with everyone. This was actually from 2015 at the National Mall. There was a rally with tens of thousands of people spreading the word that recovery is a reality. It's actually a reality for more people in America than there are addicted. So there are roughly 23 million Americans in long-term recovery and about 22 million Americans living with an addiction problem. If you can advance the slide, Tina, thank you. So New Jersey often has a reputation of having the purest and most lethal forms of heroin and fentanyl in the country. We're sort of positioned near a lot of ports, but we are also leading the way in a lot of recovery efforts. Tina went through a lot of this, but as you can see, this is sort of some statewide responses to opioid use and addiction in general. We have the prescription monitoring program that's also being coordinated with other states as well. Up here in Sussex County, you know, we're close to New York, Pennsylvania, and now people are able to check on prescriptions that individuals receive in different states. We have the disposal sites. The Overdose Prevention Act, which Tina mentioned, has a few facets to it. This encourages people to seek help when experiencing a medical emergency. This allows people to obtain and administer naloxone as a good Samaritan. And it was also amended most recently to have high schools stocking this medication in the event of an emergency. We also have overdose prevention programs around the state. So that includes organizations that are able to train individuals in the community on how to respond to opioid overdoses and distribute free kits. So we actually partner with a few different organizations to host trainings up here in Sussex County. We do have extra kits available. If you know anyone that would ever need a Narcan kit or anyone that's affected by opioid use, we encourage people to get trained and have that available. The Opioid Overdose Recovery Program that Tina mentioned is a state-funded initiative available in every county. And what that does is get people that have ended up in the emergency department as a result of an opioid overdose, get them help. So they are met with a peer specialist, someone that is trained, most of the time someone that's in recovery themselves, so that there's a bridge to recovery, that they have a conversation. We administer that program up here in Sussex County, so we work with Newton Medical Center, and we don't respond exclusively to opioid overdose patients. We are there to assist anyone with substance use disorder, and I'll talk a little bit about that later. There are also police-assisted recovery initiatives. Up here, we have the CLEAR program, which stands for Community Law Enforcement Addiction Recovery. 2 years ago, the Attorney General came out with something called Operation Helping Hand, which is another way that law enforcement can be a resource to recovery. And essentially, many different organizations and people interact with individuals that use drugs and individuals with substance use disorder. And we're all sort of coming together now to offer services, because we know that when we help people with substance use disorder and they can get into recovery, they become assets to our community. And Tina also mentioned the implementation. Oh, that's fine. You can move on to the next one. So up here in Sussex, we have the hospital program with recovery coaches. We have the CLEAR program, and I'll get in a little bit more about other programs that are available for people to work one-on-one with a recovery coach. And like I said, that is somebody that is trained and in recovery. Sometimes we can share a message, but it's not as effective than when we have a good messenger. And having that lived experience and being able to relate to somebody that has been through what you've been through helps to just break down those walls and get people on the road to recovery a little sooner sometimes. We've really worked up here to expand recovery support services. We know that substance use disorder isn't something that gets cured with treatment. It's not like you can go to a detox for 3 days and come out and be fine for the rest of your life. Long-term recovery support is critical, just like with other conditions that exist. The longer we can support someone, the better chance that they have. So recovery support is different than clinical treatment, and sometimes people can engage in recovery support services, like Tina mentioned earlier, before, during, after, or really instead of treatment, just depending on what that individual is interested in. We have also worked really hard up here to increase access to medication-assisted treatment. This is an evidence-based practice, and unfortunately, many times people just can't access the proper medical care that they need. And I'll talk a little bit more about what the center in particular offers for MAT with opioid and alcohol use disorder. And we do things like this up in our area to get people aware of the resources. We collaborate with one another, and we need to get the information out to the community that recovery is available. Help is accessible. Oftentimes, we were even talking prior to everyone joining the meeting about, the fear of asking a question in a setting like this. There is a stigma that has been associated with mental health disorders, substance use disorder, addiction, and because of stigma, people are afraid to reach out for help. There are more punitive policies that are in place. And as a result of all of that, there's a higher mortality rate because people aren't getting the help that they need. So the more education we can provide, the more support from the community that we can have, the more people will reach out for help, and the better outcomes will come of all of that. You can go to the next slide. Thank you. So the Center for Prevention and Counseling, which is right on Spring Street, right next to Family Partners in Newton, we do offer clinical services. So that's outpatient treatment for adolescents and adults. We have individual counseling, group therapy. There's really a variety of services that we do provide. And the population that we primarily serve is either the uninsured population or individuals with Medicaid. So there's only a few other providers in the county that do have funding or take Medicaid. And that's just important to note. Next slide, please. So getting a little more into medication-assisted treatment, there are 3 medications that are FDA approved for the treatment of opioid use disorder. One is methadone, which most people are familiar with. That's been around for decades and decades. There's the most research that has been done on that, and that is highly effective in the treatment of opioid use disorder. So for people that have an addiction to prescription medication or heroin. Recently, Morris County Aftercare, which is located in Denville, actually opened up a site in Hampton. So that is a huge asset to our community, so that people that live in Sussex County don't need to go all the way to Morris County every day. If you are a methadone patient, you do have to travel daily and receive your dose every morning. So it's a long drive if you have to go to Denville every single day. So we do have that available up here in Sussex now. I included the phone number and the contact info in the slide. And at the Center for Prevention and Counseling, we do provide buprenorphine treatment. So that's like Suboxone or Subutex. Those are the brand names for that medication, as well as naltrexone, or more commonly known as the Vivitrol shot. So all 3 of these medications work a little bit differently. There's not one that's necessarily better than the other. It's really up to the individual and their physician to determine what the best treatment's going to be. But we do have that available now. Really, prior to us starting our MAT program, if you had Medicaid, there was really no way to have access to buprenorphine or Vivitrol treatment. Even if you had private insurance, many physicians wouldn't bill your insurance company, and you would have to spend hundreds and hundreds of dollars every month to just get the medication and treatment that people need. So now we can take Medicaid, and we also have, in our collaboration with Newton Medical Center, the ability to give someone a follow-up appointment if they are dosed in the emergency room with buprenorphine. So in other words, someone is experiencing withdrawal from opioid use. Maybe they're addicted to heroin, they don't have any that morning, they start feeling very ill. Most of the time, what you're gonna do is go out and use more heroin, because that's what's going to alleviate your symptoms. If you try to get into treatment, you might not be able to access treatment that day by going into a detox center. So people are now able to go to the hospital. They'll be assessed, and if they meet criteria with their symptoms, they can receive a dose of Subutex or buprenorphine. They are met with a peer recovery coach, and we will arrange for them to have a follow-up appointment at our office so they can determine how they want to proceed, whether they continue taking the medication, whether they want to go into a treatment center or they want to be tapered off. It's up to them, but they will be able to talk to a doctor. Next slide, please. So I've been talking a little bit about recovery coaches. And when we started the CLEAR program, which was actually, I think 4 years ago today, it was mid-July 2016 that we launched this program, in which people in Sussex County can literally just walk into a police department and say, I need help. And they wouldn't be interrogated if they were under the influence or had some drugs on them. They wouldn't be charged with that. They could just come in, seek help, and we would meet them with a recovery coach to help them come up with a plan for recovery. So recovery coaches offer peer support, so it's non-clinical, but we help people understand what their options are. We promote all paths to recovery. So for example, many people in recovery may find support in 12-step groups or through therapy. We will promote and support any pathway to recovery that there is. And we provide telephone recovery support. So COVID has certainly changed the way that we deliver our services. It didn't stop us from serving the community. It just changed the way we have to do it right now. So kind of going back to our clinical services, we transitioned very quickly to offer telehealth. So instead of having to come into the office and meet with your counselor or meet in a group in person, we're able to do that right on a smartphone or on the computer. With recovery coaching, many of that occurs over the phone anyway, but we are able to offer people virtual meetings. And in regard to the hospital recovery coach program, we had to transition to offering telephone support. So instead of going into the hospital and meeting with that patient, typically we meet with them right when they're in the hospital bed. The hospital staff hands them a phone and we are able to have that conversation with them there. So we've been working to continue that service, and there's no way to replace sitting with someone face to face. We're all looking forward to getting back and doing that. But really for the health and safety of everyone, we've had to just change how we do things. So I included the phone number on the bottom right now. Something else that we did as a result of the pandemic and how that has affected everyone is we made our helpline available 24/7. So 844-SC-CLEAR is a phone number that people in Sussex County can call. Sometimes I'm the one that answers the phone. We have a few team members that answer it who are all trained as recovery coaches. That number can be called or texted any day at any hour. And we're available to offer support, help, connection to other resources. If somebody wants a recovery coach, they can contact us and we'll pair them up with someone for ongoing support. Next slide, please. Thank you. So I mentioned a few of these programs already, but I'll just explain a little bit more about it because sometimes people get confused with CLEAR, the Center for Prevention. ORP is an acronym that gets thrown around a lot throughout the state, yet it sounds sort of strange when you say it. But the CLEAR program, which started 4 years ago, is where people can voluntarily seek help on their own. So they're opening, the police are opening up their doors and they're saying the community can come in. Right now, we're encouraging people to just call us rather than physically going to the police department. Operation Helping Hand, which is an initiative out of the Attorney General's office. The Sussex County Prosecutor's Office received that grant. We worked collaboratively with them. And that really took the CLEAR program out to the community. So we were, prior to COVID, we were conducting a lot of outreach in different towns where law enforcement identified individuals that may have overdosed multiple times or been arrested multiple times for drug-related issues. And we actually reached out to those people with a police officer and a recovery coach to offer help. We also had tables in municipal courts to disseminate information. And right now, the way that has sort of transitioned during COVID is that when someone is under arrest for a drug-related cause, if the prosecutor's office is involved, they will give a call to the CLEAR number and get us on the phone with that individual. So we're able to just talk to them, explain what we offer, obtain their contact information, and follow up with them afterwards. Even if they're going to be incarcerated, at least we can monitor when they get out and follow up with them to help avoid that same cycle over and over again. We have something at the Recovery Community Center called Drop-In for Recovery. So that also allows people to just come. You don't need an appointment. You could just simply come to the Recovery Center. Right now, we're offering that virtually every Monday from 2 to 4. We have a Zoom that people can drop into, and we'll set you up in a private breakout room with a recovery coach. That's for people with substance use disorder, as well as family members or friends that just want to learn about some resources, some strategies to talk to their loved one or to support their loved one. We can give them an overview of everything that's available and set them up with what we call a family recovery coach. ORP, as I mentioned, we respond to the hospital. And then on the bottom of this slide, I have some of our other recovery coach programs. So this is sort of how we meet people. And if people need ongoing support, we have 2 programs that offer recovery coaching and case management services for up to a year. So the STAR program is very specific. Every county has a STAR program. We provide this service in Sussex, and this is for adults with opioid use disorder that are usually, they should be in recovery at this point, but that are in need of case management services. So that's a year of services. And MRAP, we partner with Sioux Falls Health Centers. They actually cover Sussex, Morris, and Warren County. So we provide the recovery coaching for that. They provide the case management, but this is for women that have used an opioid at least once during their pregnancy. So maybe they took a prescription medication, maybe they are on methadone or Subutex already, or maybe they were using heroin, they found out they're pregnant and now they need help. So they can get a recovery coach and case manager for while they're pregnant and up to their child's first birthday. So these are grant funded programs at no cost to the individual. To get involved, you just need to reach out to us. Next slide, please. I mentioned that we're doing a lot of virtual meetings. So everyone is using Zoom now, right? So we can provide support for individuals, for family and friends. Our website, I included the link there to our Recovery Community Center website. Everything that we were offering here in person, where people would come to the center, can access from the comfort of their own home while they're, you know, sitting in a parked car on their smartphone. I've seen all sorts of things on the Zoom meetings now. And in many ways, it's made getting to a meeting much, much easier. You don't have to worry about transportation. You don't have to worry about childcare. You don't even need to worry about how you look if you don't want your camera on, but you could still, you know, meet with other people, talk, and get that support. And we offer a variety of meetings, so not just 12-step meetings, but also smart recovery and support for family members. We also have meetings for the community. So if you're somebody that wants to get involved with advocating for recovery, we have a monthly meeting for that. We also offer, as I mentioned, Narcan trainings. So we partner with other organizations. You can get the training online and then make arrangements. Usually I've been meeting people in the parking lot to just physically give them the Narcan kit. So that's something that's available as well. I'm just looking at the time here. Sorry about that. As I mentioned, please take this number down, share this with anyone you may know that is looking for support or connection to other resources. We primarily serve Sussex County, but if someone from another area contacts us, we will direct them to the resources in their area. We do have a great network of our counterparts in other areas of the state. So if you have, I think we can take some questions. I'll also put my email in here. If you have a question and you'd like to, you know, contact us later on, you can just send us an email. Thank you.
Wow, that's a lot of information. I have to say, I'm as overwhelming as there's so much to worry about, you know, as a professional, as a parent, as a member of the community. There's so many things that I think our young people, I noticed somebody had put in the chat earlier that it's just sad that there's so many choices and so many temptations out there. But it's very encouraging to see how comprehensive your approach is into providing assistance to people. I mean, I love of course, at Family Partners, most of you know, we are ourselves peer support partners to families who have kids with challenges. And I can tell you, Katie, that I think what you do in that peer sharing and encouraging is just, it really is a key part to helping people just not feel so alone. I think not feeling understood, right, when you're struggling is just such a difficult thing. So I'm looking, I think our crowd is wowed with all the information. I should have told everyone in the beginning, we will share the video of this presentation. There were a lot of very helpful information and resources that were provided, along with phone numbers, websites, locations, programs. I can't thank you enough, because there's so many things going on that you offer. I would actually, do you pack as much into your 90-minute presentations? That's one thing I want to share with our our listeners today is, tell me about that. How often does that happen, Tina?
Whenever somebody requests
really?
a drug trend update or hidden in plain sight program. Yeah.
And I like that name, hidden in plain sight. So do you do that for other groups? Do you do that for individuals, or what is, I want to know more about that.
It's usually community, not for youth, but community, other professionals. That isn't totally virtual yet.
Okay.
That's going to take a little bit of time. Hopefully in the fall when schools start.
But you must find, I mean, you know, I always think, of course, education is power, right? Like it's just, there's so much, and I love your title of hidden in plain sight, because especially with the vaping, it's some of these devices are, the parents don't know, right? You don't even know what it is you might be seeing.
We actually have a whole hour presentation, virtual, obviously, for vaping. I thought somebody covered vaping recently for family partners. I'm not sure, but if that's something you're interested in, we could certainly, Tracy Storms is an excellent presenter at our agency, and that's her area of expertise, but that could be arranged if folks had an interest in that.
Yeah, well, and you know what, Tina, I'm interested. I think there would be other interested folks here are interested. Shoot us a message in the chat. But you know, it's just obviously it's such a big thing, and it still feels newer to the scene, right? Like that. I think that the kids, as you said, are misinformed as to the dangers involved, and the parents. I mean, the devices are so nondescript, and the odor. I think the vaping, in particular, with vaping, nicotine, and vaping marijuana is something that people need to know more about. I think that's really sliding under the radar for a lot of people, unfortunately, especially with no odor. So I have one last question. Since I'm the host, I get to ask a question. What is your position, Tina, on a legalization of marijuana? Because I have heard very convincing arguments both ways. As a professional, are you allowed to say what you believe? Because
you know what? We are grant funded through Division of Mental Health and Addiction Services from the state of New Jersey. I cannot take one side or another. What I do is provide education and talk about the implications of legalization on our young adults and our youth in the communities, and hopeful that people can make their own educated decision on whether or not marijuana should be legalized or not.
Right. So correct me if I'm wrong. I love that you said it's not your grandma's pot or your mother's pot or whatever the billboard was. It seems to me that the invention and the popularity of the vaping and the way that it's being ingested is so greatly increased. First of all, I think people who are old school pot mindset is it's not addictive, and it's impossible to overdose. I'm hearing you say both of those things are a myth. It is possible to overdose, and it is possible to be.
So you're not going to die. You're not going to die, but you can definitely overdose on marijuana and end up in the hospital. But what we're seeing with the vaping is the high levels of THC, anywhere up to 95%, and what that's leading to is all kinds of mental health issues with psychosis and paranoia and anxiety. And, sometimes that lasts a little while, but sometimes that's prolonged. And we know that there is I don't want to get into the science of it, but we know that there's a connection with use of marijuana and schizophrenia, especially for those individuals that are already predisposed to mental illness. So I'll leave it at that.
Yeah, but that's kind of scary stuff. Okay, last question, I promise. If you have to drop off, I understand, but I got my experts at lunch. What's the deal with pot use and driving? Are there rules on that? Like, I know obviously drinking and driving, there's tests,
So NHTSA, which is the National Highway Traffic Safety folks, it took them many, many, many years to come out with a tool to understand that 0.08 is considered, the maximum amount of alcohol you could have in your system. Anything over 0.08 is considered a DUI. Even under 0.08, if you are exhibiting behavioral and cognitive challenges, you could still get a DUI or DWI. You're still impaired. However, with marijuana, there's nothing available yet from NHTSA to support something similar that we have for alcohol. There's not a tool that has been proven to be effective to help combat that.
So really it's unregulated, no rules, no laws?
It would be impaired driving. And if there's any law enforcement on here, you could chime in. It would be impaired driving. But what I can tell you is that those states that have legalized recreational use of marijuana, their rates of car crashes have skyrocketed. And the amount of individuals that have marijuana in their systems that have crashed, obviously has skyrocketed. So there's a direct relation between marijuana use and car crashes in those states.
Wow. Okay. Tina and Katie, I can't thank you enough for a wealth of knowledge. I think we could ask you questions and pick your brain for a long time, but thank you very much for talking to us about this really important topic. And while there's so much to be concerned about, we are so grateful for all the good work that you do. And, it's making a difference. So we thank you for that. And for those of you who joined us today, you will receive within the next few days a copy of this video presentation along with some handouts that Katie and Tina made available to us, and along with some important phone numbers. And I just want to remind you that, family partners, we're here for you. We're on Zoom every day of the week. We offer 6 support groups, 4 for adults, 2 for youth. 1 in Spanish, and as a matter of fact, I wish I had a drum roll. I should have queued it up, but next week's Lunch and Learn will actually be in Espanol. We are doing our first ever Conversaciones mientras almuerzos. So we're doing Lunch and Learn in Spanish, and that is going to be a new program that we're doing once a month. On the 3rd Thursday of every month, we will do a topic in Spanish. And next week is the Morris County Office of Hispanic Affairs, and they will be addressing some very important things that are happening regarding laws. And I made myself some notes. Of course, I turned my page very cleverly, but they're making a presentation for us next week in Spanish on services they provide and assistance with immigration and DACA, but they're also going to do the same presentation for us in English in August. So that's coming up. So we are here for you. Call us, call Center for Prevention if you need anything. And I want to thank everybody and stay healthy, okay? Thanks very much.
Thanks, Holly.
Bye. Thanks for your time, ladies.
Bye-bye.
Bye-bye.